Hey guys, what's up? It's your girl here, the Nurse Investor. And today I actually want to shift gears a little bit, okay? And I want to talk about nursing, what I like about nursing and what I don't like about nursing. But in order for you guys to kind of fill me out, I think I have to let you know how my nursing journey started. Okay, I've been a nurse for 7 years. It's been a rough 7 years. It's been a fun 7 years. It's been everything. Okay, so when I graduated college, I graduated with a bachelor's in health science with a public health concentration. I did that because my intention was to go to nursing school. My college, my university, the nursing program was so competitive and vigorous. I didn't think that I had a great possibility of getting in. So, what I did is I applied to a second degree program, which is for people basically that have a degree in another field but want to pursue nursing. Just imagine what could be a 4 year degree jam packed into 60 months. It was hard, it was challenging, it was everything. Okay. So I graduated with my BSN in December of 2014. In between that, I did have to repeat some classes. Unfortunately, like I said, it was a hard program, right? And a lot of distractions in between that, living in a new city, and just a whole bunch of other things. But I eventually graduated in 2014 and I became a licensed registered nurse April of 2015. I got my first job a couple months after that. My first job was actually at a detox facility. So I was working with patients, clients that were addicted to drugs, whether it be heroin, cocaine, alcohol, and helping them detox, from giving them different medications. A couple months after that, I got another job as a school nurse working with adults and children with developmental and emotional disabilities. So they're, medicating them with their daily medication and, small treatments, things like that. But it wasn't really a lot of experience. So I knew I wanted to work in a hospital to get that real hands-on hospital experience. So while I was working at these two jobs, I was still applying to hospitals. Thankfully, I did get interviewed and hired for my first hospital job as a nurse. That was in June 2016. And I've been working as a med surg nurse ever since. So, about 7 years now, I've been working as a nurse. So, there are a lot of things that I like about the nursing field, and I do love being a nurse. I love the career, but there are also things that makes you shy away. And I want to go over a lot of these things. This is meant to be a conversation and a discussion. So I hope you guys join me in the comments and let me know what you like about nursing and what you don't like about it. And for those who are in nursing school or looking to apply to nursing school, I hope that this conversation is helpful to you. Just so you know what to look forward to. There are so many things I love about the nursing field. There's so many possibilities. There's so many things you can do within nursing. For one, you can choose what kind of setting you want to work in. As I said, I worked in a school, I worked at a detox facility. You can work in urgent care. You can work in the hospital setting. You can work as a doctor's office. Like, there's so many places that you can work. Okay. If you want to be a forensics nurse, you can do that. And what a forensic nurse is someone who works with sexual assault victims. Okay. So, they're the ones that do the testing and things like that. And you are the consultant. So if they would ever need a witness for that victim, then that would be your role. You could be a research nurse if you want and not even touch patients at all. There are nurses who work in IT. You can be a clinical instructor and, teach. You can be a nurse manager. You can be a supervisor. Like, there's so many things you can do within the nursing field. And that's what I love about it. There's also career advancements. And a lot of times your facility will actually pay for you to go back to school. So that's a great benefit as well. Okay, so if you want to get your master's or your DMP, you have that option, which is a great option. So your income is steady. So you don't have to worry about if you're going to get paid this week or you're not going to get paid this week. Your income is pretty much steady. So you have steady income. You'll get benefits if you work full time. Nursing is also recession proof. So it doesn't matter what the economy is doing, you're not going to get laid off from your job, right? So whether the whole world shuts down, we were essential workers. We are essential workers. So we still had to go into work. You can be in the US, you can be international. Doesn't matter where you go. You can always find a job. People are always ill. People will always need to be taken care of. People will always need to go to the hospital to get treated. So nursing, the field, you can go anywhere and find a job. And that's the other thing that I love so much about nursing. So while the requirements might be a little bit different if you are working internationally, overall nursing care, patient care is pretty much the same across the board. What population you want to work with. So whether you want to work with adults, okay, you have that option if you want to work with children and be a pediatric nurse, or if you want to work with babies, be a neonatal nurse. The population you want to work with, that's your choice. And that's another benefit of the nursing field. So you can choose your specialty as well and what department you want to work with. If you only want to work with oncology patients, cancer patients, you can do that. If you want to work in the ICU, the intensive care unit, that's another great choice that you can do. If you want to work with only ortho patients, orthopedic patients, you can do that. Transplant patients, you can do that. Cardiac patients, you can do that. So your department of choosing is your department of choosing. The hours can also be pretty much flexible depending on where you work. When I worked in the hospital, we had 12-hour shifts. So it was easy for me to put myself on 3 days and then have 4 days off in a row if I work back to back. Or there were times I would clump all my days together. So the next week I'll have a whole week off and not have to use PTO or earn time, whatever you guys call it in your hospital. So there were times when I can go on vacation and not have to use my PTO. So that was another great benefit. I love and hated working the 12 hours. Not full time anymore. I only work per diem and or travel contracts. So my schedule is kind of just up to me. But when I was full time, I love that flexibility. Another thing I love about nursing is that it can allow you to have a side hustle. And I always push for nurses to have something or do something that they love, right? Because nursing, that's what's paying our bills. But we have to find something that we're very passionate about. Not saying that you can't be passionate about nursing, but there are times when you might need a break, right? You can't surround yourself with just your job. What is it that you're doing as a hobby? You can turn your hobby into a side hustle. So if you love to cook, start a cookbook. Start a YouTube channel where you teach others how to cook. So while I love all these things about the nursing field, nursing can burn you out pretty quickly. And I learned that earlier on during my nursing career, okay? When I first started working, I was killing those hours. I was making bank, right? But over time, you can't do it anymore. It's just too much. Physically, it's demanding. It's a demanding profession. You have to lift, you have to turn, you have to bend, you have to do all these things. And then being on your feet for those long hours, over time, you start having knee problems, leg problems, all these things. So it's physically demanding. And that's what I would say I don't more so love about the nursing profession. It's good because you get those steps in. But it could be physically demanding. It could be emotionally demanding because a lot of times we take our work home with us. We might see a patient pass away, and a lot of times we develop relationships with these patients. We get to know them and their families, especially when they stay in the hospital for long periods of time. When I worked in oncology, not as a nurse but as a nurse assistant, I'll never forget this family. I had a patient. It was a woman. She was battling cancer. She eventually passed away. She had a young son, a baby, like 3 years old, a husband. And until this day, I still think about her because she was in the hospital for so long that we started to develop a bond. And you will notice that this happens a lot. A couple years after she passed, I saw her husband and her son just like randomly in the city, So you develop relationships with these patients. You end up taking your work home with you. That's why a lot of times we hear bells going off in our heads and we're like, am I still at work? Because we tend to take our work with us home. A lot of times there's a lot of stress that comes with being and working as a nurse, whether it's stress coming from within the facility that you work with. You might be stressed because you're short staffed and there's more demand, so you end up having to do more. There might be stress and pressure just from overhead people above you. It can be a stressful environment. In addition to that, we can become exposed to a lot of diseases and viruses. We saw that during the COVID-19 pandemic. No one knew what the hell COVID-19 was. And as we were just learning about this, there were so many mishandlings when it came to COVID-19 and how they treated their workers. When it comes to PPE, in the beginning, we didn't know if we needed an N95. It was just so many things going on. So we were exposed to so much. That could be a drawback of the nursing career, especially when you have a family, you have little children in the home. That might discourage you from wanting to enter this profession. Also, the hours can be long. So while some of us work 12-hour shifts, so we're only working about 3 days a week, those 3 days a week are tough, okay? Because we're working 12 hours a day out of the 24 hours. And sometimes we don't even get home until 9, 10 o'clock, depending on, how stressful or demanding your day can be. And we're leaving our house sometimes at 5, 6 o'clock in the morning. So our days can be very, very long. And a lot of times out of that day, we're only eating like one meal a day. So, those long hours can be a lot. Thank you guys for sticking around to the end. I want to know from you what it is that you do and do not like about your healthcare job. Can you guys let me know in the comments? Thank you for sticking to the end of the video. Don't forget to hit subscribe, and I'll see you guys in the next video. Bye.